Cancer can create several types of issues for people in the workplace. The most obvious thing people will think of are the effects of treatments. But even many years after cancer, there are issues that can remain with respect to cognitive functioning or concerns about, as one applies for a new job, that there'll be discrimination. The most wonderful reason why there are more employees with cancer in the workforce is that there's been such advances in cancer treatment. It used to be back in the 1960s or 70s that only maybe around half of people diagnosed with cancer would be survivors, and now those numbers just keep going up. There are about 14 million cancer survivors in the US. About half of those are of working age, meaning between the ages of 15 and 69 years. And of those, roughly around 2/3 will return to work. So at AIR, we've been looking at issues surrounding employees with cancer for some years. One impetus for that was when the Americans with Disabilities Act was amended in 2008, which made it more clear and more explicit that employees with cancer would be eligible for protection. We found in some preliminary work we've done with convenient samples that the cancer survivors we've surveyed, less than half of them are aware of their protection under the Americans with Disabilities Act. Given the long history we have working with the Southwest Americans with Disabilities Act Center, we started working with MD Anderson and with the cancer clinics at Memorial Hermann to do 2 parallel surveys that measured both survivors' own perceptions and reports of what kinds of issues they were experiencing on the job, what they were aware of as far as the kinds of protections that were available to them, not just the ADA, but vocational rehabilitation services, the Genetic Information Non-Discrimination Act, and then concurrently, what did their healthcare providers know about those same issues? So one interesting finding of that, when we looked at what survivors said in conjunction with what their healthcare provider says, was that the healthcare providers were perhaps hearing more about physical symptomology, whereas the survivors were reporting that things like cognitive limitations, fatigue, and anxiety were causing them more trouble on the job. Some of that work we built upon with our Center for Knowledge Translation for Employment Research, where we conducted a systematic review that looked at interventions to support employees with cancer in the workforce. The main finding of that was that given the gamut of issues that someone with cancer may face in the workforce, multi-component interventions are most likely to be successful. Someone will need psychosocial support. They're going to need a good referral to the vocational rehabilitation agency. They ideally would also get legal services. A lot of people overlook that. Work is such an important anchor for identity, for stability, for employer-provided health insurance. So anything that is going to facilitate keeping a person in the workforce really benefits everyone.